So as a physical therapist assistant, you place a patient on a bike, whether it's an upright or a recumbent bike. Can you charge for that time as skilled therapy? And of course, the answer is yes, no, maybe so, depends. Now, what are you doing with the patient on the bike, or what are you doing while they're on the bike? So for example, let's say you have a 67-year-old total knee replacement and you place the patient on an upright bike. Does it take your skills as a therapist or an assistant to determine the seat height, the resistance? Might you have to get on the bike yourself and visually demonstrate to the patient what you want them to do in terms of self-stretching, rocking exercises, etc. The patient gets on the bike. They begin to do what you want them to do. But are they substituting? Are they hip hiking? Are they leaning? Does it take your unique skills as a therapist or an assistant to provide that verbal instruction, verbal guidance, technique correction, posture correction, etc.? By all means, that time is skilled billable time. But now it's visit number 3, visit number 4. Patient comes in, they know how to do the self-stretching, they know how to do the rocking. In fact, because of your skills doing other therapy interventions, they can now make complete circles on the bike. And now they're just on the bike warming up for 5, 7, 10 minutes while you're doing something else. With that time to warm it up on the bike, you're not even there, is not billable time to any insurance carrier. Because first of all, you're not there, which means you're not one-on-one. You're also not providing any skilled interventions. But say in visit 3, visit 4, this patient comes in, you bring Lindsay back to the bike, you get Lindsay on the bike, and again, she can do the bike all by herself, and she's doing that for 5 minutes. But while Lindsay's doing the bike for 5 minutes, you're asking Lindsay questions, you're assessing Lindsay. You're asking her, Lindsay, how'd you feel after therapy on Monday? Oh, your knee was a little sore? Did you use the ice? Did you lay down, elevate? Did that help? Okay. Did you do the exercise at home Tuesday, Wednesday? How the exercise is going for you? Any questions? Oh, you got some questions? And you communicate back and forth. Lindsay, I know last week you still having issues doing this. How's that going for you? Maybe try this. This. So while Lindsay's riding the bike for 5 minutes, that's not what you're being paid for. You're being paid to assess Lindsay, ask her the questions, get the answers from her, because based on what she tells you and how she's progressing, not progressing, maybe issues she experienced last therapy session, is that going to help you determine, what to do today, what to add today, what to modify today, what to delete today. So that assessment time is skilled billable time. Patient just warming up on a bike all by him or herself, you're not even there, that's fine, let them warm up. Just don't bill for it to an insurance company. Hopefully you're somewhere else treating another patient, finishing with them, while Lindsay is warming up. For much more information on therapy, rules, regulations, updates from Medicare and private commercial payers, be sure to click on the link below.